All right. So I think me and Dr. William were talking about this, that we're trying to kind of get this going so we can encourage everybody who's actually going through conferences. And if they want to share their experiences to us, they can also have this little bit. So we're like little correspondents in a sporting event. And we definitely want to get the good gist for everybody in terms of how I did this was every time I probably write something on paper, that's definitely like a clinical gem for me. So for me, I'm going to share these clinical gems for everybody. It might be not a clinical gem for you, but sure, it was actually for me. So for more questions, you definitely can ask me. So going back to the conference, so this was online, so I was not there. But the thing here is everybody knows who Dr. Seeds is here in the US. And also I want to welcome our Philippine contingent here who's on board with us. And Dr. Seeds is a well-known peptide expert in our field. And to tell you the truth, this is a guy who you don't want to mess with. He's so buff, but he has a new look now. He looks like Santa Claus. So he has this white beard on him. But one thing, so he started to show, and what he emphasized was that inactivity actually is producing different effects for male and female. So if it's something that's active in the female, she's saying it's affecting more of brain function. So ineffectivity actually is going to be more seen with memory loss, brain fogs for women who is not exercising much. But for men, it's more metabolic. So higher chance of insulin resistance, high cholesterol, hypertension, and one thing that I also kind of scratched my head about was genetically, on the loci, you will find the gene for exercise and inactivity they're pretty close together. So that's why this is a teeter-totter for people who decide to exercise or not to exercise. You really have a 50-50% chance on going through this. So you just have to push through. That's what he said. And it's always influenced by the dopamine pathway. So this is our reward pathway. And the next speaker is actually all about sleep. This is Dr. Jones. And so we're always thinking about, oh, melatonin. It's always going to be melatonin now. Now, in this situation, it's not. You're talking about honokiol, DHH-B. So this is a form of honokiol. It's actually from magnolia bark extract, and it actually has a more increased bioavailability. So they're seeing that it's not saying it's superior to melatonin, but it actually gets in there because it actually has a modulation towards the GABA A receptor. And it's a calming type of supplement. It promotes NREM sleep. That's why it's in this sleep discussion. And not only that, it also has other properties that are almost similar to like a diazepam or lorazepam, to the point that you should not be taking this during the daytime if you want to be functional. And one thing that I discovered about melatonin is if you want to build muscle, you can take 10 to 15 milligrams a day. And we spoke about, could it reverse the negative feedback effect or alter that? They're saying it can, but again, the benefits outweighs the risk because it also has an anti-inflammatory, antioxidant effect. So for those who wants to build muscle, get on your melatonin. Um, and then Dr. Earls, who actually showed us a new device in relation to it's more accurate than a calcium score or using the ASCVD risk scoring to predict cardiovascular risk. This is a coronary computed tomography angiography using AI to detect how plaques are actually being found on patients who does not even have the risk factors. So this is where AI comes into now conferences, because I was in the IFM conference before, it was all AI. As evident here, AI is coming, and again, a preview for everybody that's going to be out there to help us. Next one is Dr. Hussein, who discussed about SGLT1. So this is the flozins, the dapagliflozin and empagliflozin medications. It's not only being used for diabetes now and also for CHF, but for performance. So this is something that I would suggest be kind of take it with a grain of salt. Yeah, the seeds groups, they're really kind of like still testy and touchy about these things. But some of these practitioners are doing this, and they're using SGLT1s to increase EPO for performance. It improves glycocalyx like arteriosol. Also, it has good effects on the microbiome, and there's cancer benefits for this, and even increases the grip strength of the users. The next one is Dr. Newman. Dr. Nguyen promoted the peptide called humanin. So humanin is something that actually is a mitochondrial type of peptide, and it's almost similar to MOTS-c. How it functions, it protects your mitochondria by increasing glutathione peroxidase and also catalase. So as you can see, both those two factors are potent antioxidants and can promote more function to the mitochondria. And humanin is something that's not only for the mitochondria, but they found also the benefits of that in diabetics. So pancreatic beta cells improves when you use this specific peptide. And an eye catcher for me, if you're having a problem with your patients who are having age-related macular degeneration, they found it in vitro that it actually enhances or revives retinal pigmented epithelial cells, and humanin suppresses the inflammation of macular degeneration. So that's very promising there. The next one is actually the, I think I had a conversation with Dr. Bill about this, and everyone probably will be interested in this if you're using GLP-1s in your practice. So there are patients who fail on GLP-1 or maybe needs a little bit more of a help because of the side effects if you increase the dosing. There is a peptide now called amylin, and the name brand is cagrilintide. They call it Cagri in the conference, and they found that inserting this into your program for GLP-1s would actually increase the effect of it, meaning the weight loss is better, less side effects, and also, I mean, it's expensive when you add GLP-1s, right? Now you can lower the cost of your GLP-1s when you insert this in your protocols. And again, this is better. So they showed clinical case studies there that by combining both with your GLP-1s versus a single GLP-1 for weight loss, they showed better effects. And there are statistics on their slides there. So that's a pretty good bump there for our GLP practitioners. And another one, this is for day one. This is the last presentation for day one. It's C15. It's, I don't know if I pronounced this right, pentanoic acid. But this is actually an odd chain saturated fatty acid that strengthens cells in terms of their membranes and also reverses ferroptosis, meaning we have iron. What it does do? It oxidizes the mitochondria and destroys it. This is an omega-3. It's actually classified as omega-3, and this is fascinating to me that the last discovery of an omega was actually 90 years ago until this came to be. So they discovered this again. And oh yes, I see Kent here. Kent is part of this.
Yeah, actually it's an essential, it's the newest essential fatty acid identified.
Right.
And it's because how horrible our food supply has been damaged by a number of pathways that I don't want to get into, but it's a remarkable substance. Oh, sorry for interrupting.
Oh,
I'm excited about it.
Yeah, I'm taking it. So I know I from the get-go when I saw the studies about this, the studies now they're working on longevity. They're showing that it's almost in the upper echelon of rapamycin. You're talking about telomere enhancement, right? TA65. So this is almost getting there to that point that they're almost comparable, but studies are being drawn out.
When they first introduced it, and I heard about it 4 years ago, they were talking about it doubling the life of the Navy SEALs dolphin program. They were having real challenges in their health, and they were able to, and it's a mammal, so there's a direct relation to our, genes. So it's remarkable to the point where I'm putting everyone I care about on it.
Right. I agree. And that's again, you were there. I know Troki was there. It's I don't know if we can say products, but I'll tell you if somebody probably asks. But definitely, it's something worth looking into because I already have started patients on it, and they're definitely getting the benefits. I have a question here. Just I saw that. Am I talking about resolvins? So this is a good question. It's not related to resolvins. So you can only get resolvins through, they're called SPMs. You only get this through omega fatty acids. And I mean the fish oils. But this one doesn't produce that. That's why it's one of the discussion there is, should I now stop my omega fish oils? Well, I'll take fatty 15 or well, C15. It's a no. You still have to combine both. It's just because C15 brings so many different things to the table that omega fish oils cannot, and vice versa. So that's why no, the resolvins are not included in this discussion. So that's day one. So it ends there, and it's all like, yeah, we love the information for sure. And day two starts. So day two is Stephen McCain, who's an Olympian. He actually kind of hammered it into my head that exercise is like church. So I think everybody knows about that. Stefan, you're probably practicing this, but he hammers it real good to everybody. And he's emphasizing on VO2 max. So VO2 max is only part of, there's a machine that he was mentioning, is PNOE machine, that actually measures VO2 max, metabolic rate, biological age, in 10 minutes with a lab-grade accuracy. It's a non-invasive machine, actually, and without lab work. It's like an oxygen mask that you put on your face, and it's connected to a device. And then the next speaker is Dr. Keller, who's a pediatrician who spoke about post-COVID changes in children. And she noticed that these children, after having COVID, suffers from depression, anxiety, severe weight gain, and also aggressive behaviors. So meaning aggressive behaviors like biting, scratching their moms. So what did she do? She tried tryptophan on them. And because of the reason that she wants to increase serotonin. But the bigger question was, why did you just not start serotonin? What I found out was serotonin created from the gut actually does not go to the brain. I mean, it does go, but there's only a small amount that goes in there. If you want to stimulate serotonin to be produced in the brain, you introduce tryptophan, which is the original amino acid for it. So that's a learning point for me. Now I know better. I thought just serotonin, just boom, it happens into your head. But as she used tryptophan on these children, it worked for a little while. The thing here, as you ran the cycle, she found out that cofactors were actually running out. That's why these children became symptomatic again. So what she did, she added zinc, folate, and 5P5, which is pyrophosphate, pyridoxine 5-phosphate, the more active form of pyridoxine. So those are kind of gems if people are seeing children. But she said that you can definitely try it on the adults who also has post-COVID. The next one is Dr. Stats, who spoke about vagus nerve. I saw this guy in IFM, and he basically said the same spiel. But one thing that kind of, again, maybe I forgot, I probably slept for a little bit during his lecture. I actually now remember that he mentioned that the vagus nerve, why is it immune supportive? For the reason that it actually has a connection to your spleen, and it stimulates the T cells that are in the spleen. Thus, the T cells produce macrophages to actually produce anti-inflammatory cytokines. So that's something that, wow, that's new. Maybe it's not, because I probably just like closed my eyes or sneezed. I didn't hear it. Next one is Dr. Sure, is a fertility doctor. So he advises all his fertility patients, he basically puts peptides on them and to actually promote FH, LSH production and growth hormone. He used thymolin and also epitalin. So if you have patients who are actually needing, looking for fertility, those are the two peptides that you can use. And then Dr. Will Haas was the one who spoke about the business of IV therapy. So he emphasized on sandwiching the services, meaning, well, for example, he does IV therapy on patients. So he does a foot bath, for example, or a brain tap machine that he attaches to them. So this increases revenue and also the efficient use of time for patients. These patients always say, go, go, go. You want to go, right? So give them a bang for their buck by doing multiple procedures in one sitting. And then the next one is Dr. Elizabeth Yerth. So this is a lady who you don't want to mess with too. She's muscular, very intelligent, and she spoke about repurposing drugs. So one thing to give credit to the CDPM group here is they spoke about Amlexanox. I know already it's going to be big when Dr. Halasta started to talk about it, but they're now harping about this for the same reasons that it actually is one drug that actually has so many multiple uses: anti-inflammatory, anti-allergy, anti-cancer, even for osteoporosis. And another one, if there's a choice for blood pressure medicine, telmisartan. It does not only have the cardiovascular benefits, but it increases cognition and longevity. And one that I'm pretty interested in also, and maybe Stefan, you can chime in if you know anything about this, sildenafil. So PDE5 inhibitors are being used before workouts for athletes. We're not talking about the 50 milligrams per day. You don't want to get an erection while you're working out, right? So we're talking about 2.5 milligrams to 5 milligrams per day, and also still keeping an eye out for the blood pressures. But very minimal, and there are discussions there where athletes are using this to just enhance workout optimization. And next one is Dr. Berkson, Lindsay Berkson. You're probably familiar with her too. What she spoke about, this lady was amazing. She didn't even use slides in her discussion because there was a question that got her all revved up, and she turned it into one whole presentation. The question by Dr. Caesar was, tell the evidence about estriol not being bad to be used. Because there's a journal out there that, which I don't know about yet, they're saying estriol has detrimental effects. The specific one that was there that was specified, but it paralyzes the estrogen receptor. So she got this whole spiel about it's an anti-cancer estrogen, and also it helps with autoimmune diseases. So it's very compelling. And one thing that struck me in this talk was your vocal cords are aligned with estrogen receptors. So that's why you get a little huskier when you get into the menopausal stages. So that's what she mentioned. So now I'll probably keep an eye on that on my patients too. And next one is Dr. Mitch Fleischer, who actually spoke about peptides in cancer. So the one thing that he kind of, I guess, proved that BPC 157, so some people are talking about it to be cancer promoting, but in his practice, it's not. It's actually helping patients recover from radiation, from surgeries. So BPC is very safe to use. And also, as he recommends, KPV is also an MSH derivative, which actually lowers down NF-kappa B and MAPK pathways. And one thing also that's interesting is the use of GHKU, copper, in cancer patients. I thought it was only for aesthetics, but he's saying that, again, this is a peptide that has multiple anti-cancer and anti-inflammatory properties that downregulates metastatic genes. And also, as I mentioned, you can definitely heal your patients who went through radiation, surgery, also the UV radiations. And thymosin alpha-1, as we always know, is always useful for cancer. And TB4, it's not only for healing, but he's also using this in cancer, the cancer damage procedure that I just mentioned a while ago. And in the States here, TA1 is not much available now. Thymulin is something that he substituted for that. And then lastly would be Dr. Ross, who's the owner of Chimera Exosomes. So he actually mentioned the new innovations in the use of exosomes, that now there's a focused low intensity ultrasound that you can actually use to target, to tell your exosomes where to go in terms of what area or what body part that is damaged, so it can be directed towards that. Another striking thing that I saw in this presentation was a finger that actually got severed. What he used there is an amniotic patch. So that you would see from the pictures that this finger actually regenerated. For some reason, I don't know. I don't think that's a camera trick, but that's impressive. He's using an amniotic patch for that. And exosomes, I thought, only goes to the lungs, right? And even stem cells. But on his, I think one of his discussion here, and it was shown on a diagnostic scan, that it also goes to the spleen to increase the macrophages and stimulate it to, of course, support the immune system. And local injections, maybe some of you know about this already, that it actually goes into the systemic circulation. And also, you know about this as well, that microneedling recovery is faster with exosomes. So that was my 2-day report on our SEEDS conference. And yeah, I sound like a sports reporter here, but I hope everybody liked it. It's a summary.
Yeah,
And if you have questions, feel free to ask.
You could, they're asking if you could put in the chat where at least type out some of the peptides that you mentioned, because you went kind of fast on some of them. So if you could do that, throughout the talk here, that would be great.
Sure.
Okay.
All right, over and out.
Okay. All right. Well, thank you, Stefan and Dr. Seeger for being patient here. For those of you who, again, just one last time, Dr. Nelson fell ill at the at the last minute here, and he won't be able to make it tonight. We will have him on another time. We have Stefan Hartmann and Thomas Seeger have graciously decided to volunteer to step in, and we're going to hear about cold forge therapy. So Stefan and Dr. Seeger, take it away.
Excellent. Thank you. Thank you all for joining us tonight. And thank you, Dr. Seeger, for also coming on last minute here to give your talk as well.
Yes, thank you, Dr. Seeger.
It's a pleasure. You should know that I'm a PhD in engineering, not a medical doctor. The vocabulary that
Melvin
just went through mostly went over my head.
Right.
So in other words, you're
that-
a real doctor. Not like us fake
the research kind. Yeah, I'm not disadvantaged by medical school. I can put it that way.
Yeah, not like the rest of us.
You're right.
So,
But I like the way that
thank you for being here, and thank you for the last minute.
It's a pleasure. The way that Stefan outlined it, I think made a lot of sense. I'd like to talk generally about cold water immersion as a therapy, and then ask Stefan to give some examples from his practice of what he's seen, sort of these N=1 case studies, and we might be able to wrap them up to some general ideas about what cold plunge therapy can offer. So let me talk about the therapy aspect. There is a lot of entertainment when it comes to ice baths. It's all over social media, and you get a lot of clicks and a lot of attention. If we're going to talk about a therapy, though, we have to understand when would it be indicated and what are the contraindications. Because cold plunge is a systemic therapy, much like exercise or sunshine. You can't target just one aspect of the body with cold water immersion. You have to think
Dr. Seeger,
about how
moment.
all aspects respond. And so I'm just going to hit the highlights here. There are three things that might lead you to think that a cold plunge or an ice bath would help your patient. When you see metabolic dysfunction, so this could be type 2 diabetes, it could be insulin resistance, and all of the constellation of other symptoms that result from that, cold plunge therapy is a good remedy for improving insulin sensitivity. So the first is the metabolism. The second is chronic pain or chronic inflammation. So this could be autoimmune in its origins, like rheumatoid arthritis, or it could be originating elsewhere. But the cold plunge is very good for chronic pain and inflammation. The third one, which might be surprising, but it's a low mood or a major depression. There are a number of case studies now of people who have failed to respond to SSRIs, have failed to respond to talk therapy or group therapy, and then say their major depression was resolved by either winter swimming or an ice bath. So when you see any of these three things, cold plunge should come to mind as a potential therapeutic remedy that will improve a long-standing and intractable condition in one of your patients. The contraindications, and Stefan has seen this for himself, the most important one is hypertension. If your patient comes in with high blood pressure to start with, the whole body cold water immersion is going to induce vasoconstriction. It's going to force the blood into the core and into the head, especially if the head, because it stays out of the water, and it's going to raise blood pressure temporarily. For most people, that's not a big deal. But if they are already at a high level of blood pressure, they can experience an acute event for which the remedy is vasodilation, is to warm them up. But Stefan can tell you about a patient for whom it was extremely worrisome. So what are the mechanisms? Stefan showed you just very briefly the brown fat slide.
Yeah. Are there any other slides you want me to pull up here? You let me know.
Number 3 on this list.
Okay.
It used to be, there you go, that physicians believed there was no such thing as brown fat in adult human beings. Infants are born with it, children have it. But for a long time, we thought it was inevitable that in adulthood, the brown fat eventually disappears to nothing. And so that persisted until the invention of the PET scan. And so you use PET scan to locate tumors that have an affinity for glucose. And as this team in Sweden was reading their PET scans, they kept coming up with these symmetrical spots on a few patients that could not be explained as tumors. Well, the PET scan machinery, especially at that time, it was very warm. They had to keep the instrument rooms cool to keep the machinery from overheating. And they were cold enough to activate brown fat in some of these patients. So the Swedish team hypothesized that what they were looking at was brown fat. Sure enough, these cancer doctors at the Sloan Kettering Institute in New York went through and they reviewed thousands of PET scans from cancer patients, and we began seeing brown fat on about 5%. That is, most adults aren't getting enough cold exposure to maintain their brown fat into adulthood, but a few do. When you lose all that brown fat, you lose not just the thermogenesis, that is the capacity for thermal regulation, but you also lose brown fat as a secretory organ. You lose the way that brown fat will modulate the thyroid. You lose the conversion of thyroid hormone from less active to more hormone, to more active, which happens in the brown fat. You lose the neuroprotective factors that the brown fat will secrete. And so I think brown fat is an essential organ. It's not sort of a nice to have from childhood. It performs these functions that regulate metabolism and protect the brain in ways that are essential to long and healthy lives. It takes decades to lose the brown fat. It takes about 2 weeks of regular cold plunge therapy to recruit the brown fat back. And that's the good news, because there's some good studies on cold air and cold water that show insulin sensitivity goes way up. Other things go way up, in particular, mitobiogenesis. The principal physiological difference between white fat and brown fat is that brown fat is packed with mitochondria to do this non-shivering thermogenesis. When you activate your brown fat, you stimulate mitobiogenesis that improves the quality of the mitochondria, not just in the brown fat, but throughout the body. So this is the most important physiological change that happens when a patient starts a regular practice of cold plunge therapy. There are other things. In the short term, the rush of adrenaline, the rush of dopamine. I mean, it's hard to be in a bad mood when there's 3 times the dopamine levels going through your bloodstream. And so this is a good low mood interrupter. But these are short term. One of the advantages of the ice bath is when you get in, you know it's working. It's you could take a peptide, you could do an IV, you could do hyperbaric, and all these things can be healthy for you. But you get into the ice bath and the person will instantaneously know something has happened because it is activating their sympathetic nervous system. When they stay in long enough, and we're talking about 30 seconds, it will also, the sympathetic will yield to the parasympathetic. It will also activate the dive reflex. So this exists in all mammals, where the body involuntarily prepares itself for the oxygen deprivation of the dive. The brain waves collapse into a more meditative state. The heart rate typically slows. The rush of blood glucose that was released from the liver, it is consumed by the brown fat and shivering in the muscles. So it clears glucose from the bloodstream, and the body enters this, even though the metabolism in the brown fat is revved up, the body enters this state in this parasympathetic state of relaxation. And patients are reporting this to us over and over and over again. When they make it through the first 30 seconds, then they say, oh, gosh, I don't even know what I was afraid of. I don't know what I was all worked up about. This is actually relaxing. That's especially true after they become acclimated to the cold, which takes about 2 weeks. The last thing is their heart rate variability. It has often gone through the roof. And because HRV is an indication, a physiological marker of psychological resilience, watching the HRV jump is very satisfying. So I put together some slides for a presentation I did recently that talked about some individual case studies. One of these is a man in Oregon who contacted me. He wanted to buy an ice bath. This was very early in the days of our ice
Which
bath
one?
company, Morozco Forge. And he was remarkable because he had leukemia. He knew that was a death sentence, and he decided he wanted to do something to inspire cancer patients. He'd already lost his wife to cancer. His
Which
name is
slide?
Dean Hall. And I'm forgetting exactly which slide it is, but you go down 2. There's Craig Heller. Go down 2 more, and you will find a picture of Dean Hall. On the left, you can see his lymph nodes are swollen as his R left, but on the right is after he swam the entire length of the Willamette River in Oregon. It took him 3 weeks to do it. He was in a nearly constant state of hypothermia and ketosis. When he went into the Willamette, he had leukemia. When he came out, he didn't, because all of his blood markers had disappeared and his diagnosis disappeared with them. So that's a remarkable story that I had to pursue in more detail. It turns out that there are 3 pathways by which cold plunge therapy would inhibit tumor growth or enhance the recovery of a cancer patient. And the first one is metabolic. Most tumors are upregulated for glucose metabolism. They will consume glucose first. And when you activate the brown fat, this is a study from Secchi et al. And I do have a slide on that. Go up a little bit. Yeah, boom. 2 after Dean. You're going to see their data in rodents, but they replicated it in a Hodgkin's patient. When you activate the brown fat, it will preferentially clear glucose from the bloodstream for thermogenesis in the brown fat and starve the tumor cells. So that's the first mechanism. The second mechanism is nothing will produce ketones faster than cold water immersion. So as you produce the ketones in the bloodstream by activating this fat metabolism, the ketones have an additional inhibitory effect on the tumor cells. And we know this because Thomas Seyfried, I put his book up there, Stefan, and it is further down. It's after Dean Hall. Thomas Seyfried, I believe he's at Boston College, and he wrote this great book called Cancer as a Metabolic Disease. He administered ketone bodies to rodents that had, these were mice, that had tumor cells implanted in them, and discovered that the exogenous ketones inhibited the tumor growth. And then the third one is very surprising. This is the bowhead whale study. And I don't have it in this slide deck, but these are researchers at the University of Rochester. And they were curious about, if I remember correctly, it's Peto's paradox. If cancer originates in mutations of the nucleic DNA rather than in the DNA in the mitochondria, but in the nucleus, then wouldn't a bowhead whale, which is enormous and lives for 200 years, be riddled with tumors by the time it was 70? And, you know, the hypothesis that says it originates in these aberrant mutations suggests yes, but the bowhead whale is not. It lives virtually cancer-free for centuries. The University of Rochester team decided they wanted to look at that, and they discovered that there is a cold shock protein that will repair the DNA in the nucleus. So these are the 3 mechanisms: the metabolic starvation of the tumor cells by clearing glucose from the bloodstream and consuming it in the brown fat, the production of endogenous ketones, which will further inhibit tumor growth, and then lastly, this cold shock protein effect that can repair defects in the nucleic DNA. The other person, slide up 2 more, Stefan, back to the Dean Hall. The other person that I know of outside Stefan's practice, she's on the right, she's on Twitter. Her name is AJK. There she is. She was diagnosed with a tumor on her liver. And because she had a history of bleeding disorder, nobody wanted to operate. It would not respond to radiation or chemotherapy. As the doctors understood it, the best thing she could do was watchful waiting. And to her, of course, that sounded like a death sentence because tumors just don't pop up out of anywhere and then go away by themselves. So she wanted to know, what could she do? I said, you're going to do what Dean Hall does. She went into ketosis and she started practicing ice baths. She got a scan 6 months later, and damned if that thing hadn't shrunk. And so these are these sort of n=1 phenomena that stimulate my curiosity to go back to the library to see what are the mechanisms by which we might be able to explain what otherwise would be a miracle. But I can tell you that these people don't care. They don't want to understand it. They want it to work. And it is an enormous relief to them to know that they can use cold plunge therapy, at least in an adjunctive sense, at least to complement their chemo or their radiation or whatever else they are doing, because there are no adverse side effects, except for maybe the cuss words that we're all going to scream when we first get into the ice bath. So that's my brief synopsis, Stefan, and I'm hoping that you can add to it with more of the experiences of your patients.
Yes, I can. And, I got into this from my own research. I was trying to research longevity and how to help people heal. And I came across cold plunging as one of the 3 pillars of longevity. Like my initial research was like cold plunge, sauna, and like autophagy. And like what these all have in common is they can essentially put you into that state of detoxification where you can start clearing out dead, dying cells, inflammation. All these 3 have potential life extending properties. So some of the initial research I got into when looking into this was mostly on cryotherapy, like nitrogen sort of cold therapy for sports performance, because I come from an athlete background and all athletes know to use cryotherapy to help accelerate return to the field after injury or after really hard training. So when I play professional tennis, I really wanted a cold therapy pool just so that I could play a tournament Saturday and get right back on Sunday and play again, because that's how it is highly anti-inflammatory. It can help you recover. It's not the greatest for building muscle, because when we're going to the gym and we're trying to deliberately cause inflammation in the muscle, that causes hypertrophy, so large biceps. But when we're looking at from a performance perspective, say professional tennis players, whole body cryotherapy has been studied in, for example, professional tennis players, and demonstrated that it can improve shot put accuracy just doing whole body cryotherapy. So that was interesting for me. But then beyond the athletic performance capacity for this, we know that it also helps with chronic injuries. So I got down and started learning about how it can help with orthopedic injuries like adhesive capsulitis, which is a really terrible condition if you ever encountered it in like a pain management practice. It's very hard for the patient to recover from it. They need steroid injections, they need physical therapy, but whole body cryotherapy helps with this painful condition as well. And that led me down to other conditions of the musculoskeletal system like osteoarthritis, which is another debilitating condition leading typically to complete joint replacements or lots of steroid injections, which do cause some degeneration further of the cartilage. So I'm not a huge fan of those. But whole body cryotherapy has been studied in osteoarthritis and demonstrated that it can improve their quality of life and even downregulate some of these cytokine markers. And then that brought me down to the metabolic derangements, because we all know that the metabolic disease, geez, my slides are all messed up for some reason. The metabolic disease drives all of these conditions, the osteoarthritis, any sort of inflammatory condition. And so I found some research indicating that you can even change lipid biomarkers with whole body cryotherapy. And this was a study that looked at whole body cryotherapy in comparison to, well, just on its own, but I looked at it compared to Lipitor data. So the whole body cryotherapy can reduce triglycerides pretty significantly. It can increase HDL cholesterol. It can reduce LDL cholesterol. If you compare that to a statin therapy like a lipid, you may not get even these large changes in triglyceride reductions. And we know you do not get HDL improvements from statin drugs. And then this is what Dr. Seeger was talking about, the Browning effect. So you can convert white adipose tissue, which we know increases cancer. It increases cardiovascular disease. It contributes to high blood pressure and increased cytokine response. When you're exposed to, say, COVID-19, for example, you have that high cytokine inflammatory response. But the whole body cryotherapy, it can convert that inflammatory white adipose tissue to brown adipose tissue, which previously was thought to only exist in like neonates. But we now know that's not true. And you can actually create it. You can create it through exercise, and you can create it through cold thermogenesis. Here's a lot more on that. So I want to get into my research that I did here at Iron DPC. I call it the Iron DPC's Cold Forge Retrospective Practice Audit. It's not super pretty, but I had some input from some colleagues of mine, pain management specialists, Dr. Bradley Goodman. He gave me some suggestions on how to put together a study like this. So I try to make it as comprehensive as possible, because I was trying to figure out what this can even do. Mental health, physical health, return to performance, avoidance of surgeries, avoidance of interventions. And what we'll find in this little lecture here is that it has multiple modalities that are comparative to it, including injections of cortisones, chiropractic care, physical therapy, pharmaceutical therapy, and herbal therapy. It's either equivalent or benefit to, or better than those when you compare the two. So what I run is a direct primary care anti-aging medicine practice, but behind the shop, the medical offices, I have this high-performance gym area. And it's a completely separate membership, and patients can come there. I should call them members can come there, or their patients too, and they can use these healing modalities. So we have the Morozko Forge. And I specifically, I'm not sponsored. This is a CME lecture. This is not sponsored by Morozko in any means, but I got the Morozko because it gets to a temperature about 36 degrees Fahrenheit, sometimes lower. And my theory was that you need to have freezing waters to have these anti-inflammatory benefits. And lo and behold, that's what we figured out. So a summary of what we're going to see in the lecture here is that, one, pain management is better or comparable to pharmaceuticals, it seems like, with this. We've had even like disc herniation pains. We've had one young female with this. We've had hamstring tear pains controlled. We've had arthritis pains controlled in 2 men for their hips. And we've had vagal nerve dysfunction, PTSD improved in females. So there is a mental health component to this. I think it has to do with deliberate cold exposure stimulating the vagal nerve, the cranial nerve number 10, that goes all the way from your brain down to your gut. It's that rest and digest nerve. And by deliberately going into the cold plunge, my theory is that if you sync up to the neck, you can get that vagal nerve stimulation. We use this trick all the time in the ER when the patient comes in with supraventricular tachycardia. You can plunge their face into a cold bucket, and we know sometimes you can get the patient out of SVT just by doing this. So my theory is with deliberate cold exposure, you can even help patients overcome or retrain their vagal nerve dysfunction. So we've seen anxiety and depression improve in both men and women, and having them stop actually their psychopharmaceuticals. We've been successful for at least a couple psychoactive substances. Well-being and vitality return after sessions at the facility in the cold plunge. We've had substance abuse cessation as well. We've had patients who have addictive personalities, alcohol use. Oops, someone's echoing me. Alcohol use disorder. They can replace that with cold plunge. Now, some people may criticize cold plunge and say, well, it's addictive. It's a negative. Well, you do get a lot of hormones from cold plunge. You get dopamine. You get norepinephrine, you get adrenaline. And yeah, these could be molecules of abuse, but we're getting it essentially in a natural way. And it does help people avoid more harmful substances just by doing this practice. We've had patients with costochondritis. I've had at least 2 of those, do cold plunge therapy and control the costochondritis better than pharmaceutical medicines, including dexamethasone and colchicine. So the methods, we have it maintained by my dad. He's an aerospace engineer. He maintains the temperature at a strict 36 to 38 degrees Fahrenheit. It's about 2 to 3 degrees Celsius. The members have 24/7 access to this facility. And what I did is I had them fill out this form as a clinical outcome measurement, brief instrument, combi. We also use the visual analog scale to determine their pain benefits before and after. Members had at least 1 month experience, and so there were approximately 70 members at this facility at the time. So there's a lot of information on these pages. So this is mine. It kind of gives you an idea. We have the visual analog scale here on the right, so patients could look at this and they could, we all know the painful face and the happy face. But this is a kind of like a shotgun approach to this. I'm sure other studies, if we wanted to tailor it, we could focus on one part of this. So mine's kind of boring. I didn't really have too much to experience. I mostly just use it as a pre-workout because it energizes me and gets me ready to hit the gym afterwards. This patient's a little bit more interesting. A 62-year-old male. He has inflammation, soft tissue pain, and fatigue. He would rate his pain before the cold plunge as a 6, and then afterwards at a 0. So he had a pretty significant improvement, and he would come here pretty much 3 times a week to find the benefit. We also wanted to know how long they would find a benefit from this and what their mood would be like before and afterwards. So their mood before was a 5. Again, this was rated on the visual analog scale. It's something that I learned about in psychiatry. You can rate their mood from a 0 to 10 scale. It's kind of quicker than the PHQ-9. After cold plunge at 10, they note the energy benefit for 4 to 6 hours. They stay in there about 4 minutes. This person here, they seem to also put their hands and feet in the cold plunge. So other things they've tried as well, and this is other things I wanted to note in the study, is what other things have they tried, and have those things helped at all, or are they comparable? And they had tried NSAIDs, chiropractic, deep tissue massage. And what I want to know is how does it compare? And this patient related better overall results. And interestingly enough, after 5 weeks, lost 5 pounds with no variables changed. I would suggest the decrease in these 5 pounds is probably inflammation going away. Inflammation holds on to water weight, and the cryotherapy is highly anti-inflammatory. This is another patient, age 60, having irregular sleep. They didn't really have pain per se, but the mood improvement was from a 7 to a 10, and the energy benefits would last all day. They would go 7 days a week because they loved it so much. Another interesting thing this patient noticed was their skin roughness improved and their joints feel more lubricated during exercise. The mind is clear and the energy is fantastic. This is another patient. So this is interesting. She's a 29-year-old female. And I sometimes get a bit of pushback from, social media influencers, maybe who cater to more female crowd. They say, cold plunge is negative for your hormones. Young women shouldn't do it. Well, this woman, 29-year-old, suffering with a herniated disc pain. She's trying to avoid surgery. She's in constant pain from it. And she noticed fantastic benefit from the cold plunge. She was also having a bit of anxiety and depression. Her back pain, she rated at a 6. And she felt fantastic after cold plunge, and she would come pretty routinely. Her mood would also improve from a 4 to a 6, and she would stay in there about 2.5 to 3.5 minutes to find this pain management benefit from her disc herniation. So, for a young female like this to avoid having to go and see pain management, to get maybe injections, rhizotomies, even, God forbid, surgeries. I mean, she didn't really have any weaknesses or anything like that. No myelopathies. She just had chronic pain, and she was just trying to feel better and not be depressed about it all the time. And this helped her. This patient is a 40-year-old female, and she had costochondritis from a virus. I remember seeing this patient, and we had tried a lot for her. We tried ibuprofen, didn't really touch it. We did steroids, corticosteroids. We did even glutathione cocktails, and it lasted. That stuff did help, but it wore off. And she didn't like the corticosteroids. It made her feel a bit loopy. but the cold forge did take away the pain. She had to do it once, and the pain benefit lasted about 48 hours. She had to come back. She did it again. And I think she did it one more time. And just doing the cold plunge, she got to avoid ibuprofen and corticosteroids. If you've ever seen patients with costochondritis, it's a pretty debilitating condition. They can't take deep breaths in because their cartilage in their rib cage moves every time they take a breath. And so sometimes they can actually develop atelectasis and pneumonias secondary to this because they're not taking deep breaths in. So it's a condition that needs to be treated. So for some patients, I also had printed it out. And so this patient was 48 years old, using it for chronic pain. Noticed very much improvement after cold plunge therapies. The mood went from an 8 to a 10, benefits for 4 hours. And this patient said the cold plunge is the only thing that has numbed their pain, their leg pain. This patient was using it for joint pain, fatigue, and muscle pain. They would describe their pain as a 6, and afterwards as a 1, much improved, benefit for energy, at least 2 hours. Their mood would improve from a 4 to a 9. The patient had tried many other things: chiropractic, massage, physical therapy with minimal benefit, myofascial work with some improvement. Natural supplements were no longer helping, right? Like your basic turmeric and so things. Ibuprofen helps best, but he tried to avoid it much because he's 74 years old and he doesn't want to kill his kidneys by taking ibuprofens all day long. Pre-workout plunge energizes for resistance training. So these patients will also do resistance training after the cold plunge. He notices that the sauna, which we also have on site, it neutralizes or cancels out the cold forge benefits. So something to note there. Definite pain reliever, but when doing sauna after, pain is canceled out. So this patient maybe not be doing sauna so much. This patient, very interesting here, wrote me in our portal, was doing cold plunging 4 times a week, 4 to 5 minutes per session, maintained a diet of 2,400 calories. This guy's a long-term bodybuilder, so he's very good about counting his calories. He did no cardio in addition and continued his regular current protocol. No variables changed except the addition of cold plunges 4 times per week. Now at the end of 6 weeks and approximately 23 cold plunge sessions, he's down 14 pounds. So from 265 to 251. So pretty big drop in his weight. On top of the weight loss, his muscle aches, pains are greatly diminished with 0 NSAID use within the past 6 weeks. This patient is quite impressed by this. Again, my theory is this is inflammation just disappearing from the patient, especially if he's adding that his pains are decreasing without having to use ibuprofens. This patient, 43-year-old, is coming here for sciatica. Let's see, the pain, 7 out of 10, so that's pretty bad pain, and very much improved after the cold plunge therapy. Enjoyment in life was improving. The mood went from a 5 to a 10. The benefits for the energy lasted 4 hours. They needed to come 5 to 7 days a week to see the benefit, 3 to 4 minutes inside the cold plunge. This patient, 43-year-old male, presents with bristling back and leg pain that started after a deadlift exercise several months ago. The pain radiates from the left buttock down to the ankle, occasionally affecting the butt and the lower back. Initially managed the pain with ice baths and stretching, but it didn't get much benefit from that. He describes a temporary relief, increased range of motion after ice baths. Positive for facet loading, L4, L5, no tenderness, piriformis, chronic back pain. So he got a little bit of benefit from the cold plunge. 37-year-old. Let's see. Oops, we're jumping around here. 37-year-old. Inflammation was the target to treat here. Inflammation. Let's see. 6. Pain was a 6 and went down to a 2 after the cold plunge. So that's happy to report that. Another one, 45-year-old female. She reports pain relief and improved mood from cold plunging. And we have another 26-year-old here. Let's see. Not too much to report there. I think that's all we have. That's all I had here to report for this little retrospective practice audit. So lo and behold, like pretty much everyone has a benefit from this. Like the number needed to treat is so low that I have a very low threshold for prescribing this to patients to see if they can get a pain management benefit. If we ever had any medicine like that, I mean, Big Pharma would be knocking on our door all day long to sell that to us, but it's just cold. You know, you can't really sell cold.
So, Stefan,
Yes, Dr. Patel.
have you found somebody who has a problem with thermogenesis that they cannot tolerate this, or how do you prepare them? Those who have a cold intolerance,
Yeah, you
how do
get,
you prepare them?
as Dr. Clearfield would tell you, you got to treat the thyroid. You got to bring their thyroid up.
No, it is not thyroid problem. It is one of the chemically sensitive patients, and they have it is very well known that they do not, that thermogenesis is not as good.
Oh, like Raynaud's syndrome, right?
Well, yeah, Raynaud is nothing but early vasculitis. So, so how do you prepare them?
There are two cases of women who have resolved their primary Raynaud's using the ice bath as exposure therapy. And AJ is one of them. In her case, it was coaching that interrupted the feedback loop between the psychology, that is the anxiety, and the extreme vasoconstriction. But in the other case, it was a combination of coaching and starting at warmer temperatures. A good rule of thumb is you go cold enough to gasp and long enough to shiver. If you've gasped, you know the brown fat is, if there's any brown fat there, you know you've got that cold shock sympathetic nervous system activation. The hypothalamus is looking for that brown fat. It's trying to signal the shivering in the muscles. It's saying we must defend core body temperature. Then after you've gone cold enough to gasp, you go long enough to shiver. And this is just when you're starting out. For some people, that might be 40 degrees. For me, anything that isn't in the low 30s is just boring, but I'm cold acclimated. For others, I've seen them gasp at 66 degrees Fahrenheit, and that's okay. They're in no danger, but they've activated that gasp reflex. The sympathetic division of their central nervous system says, this is an emergency. It's not a thermal emergency. It's more of a psychological emergency. And that's how your body will respond to the hormetic stress of the cold. So my advice, if they're feeling thermogenetically impaired or their thermoregulatory systems aren't highly functioning, is to start them gently. Judge their response so that you can calibrate the cold dose.
So would you tell them to start preparing at home, that try to have your shower temperature just reduced as much as you can, and from there you know that they will be able to tolerate something like that?
I would take a different approach than the shower. And this might be personal, but I hate cold showers. They make me angry. I would say run the bathtub. Now, not everybody has a bathtub, especially in Europe. You know, the apartments can be really small. But in America, most people can have a bathtub and they just ignore it. Run it with tap water. Now, in Phoenix, Arizona, where I live, in the summer, the tap water gets up to like 90 degrees.
That's right.
Right? So
Right.
what I started with was buying bags of ice from the gas station and putting bags of ice to get the water temperature down. You can do this whole body is what I recommend, because if you start with cold showers, and a lot of people do, I did, it makes it activates the sympathetic nervous system, but it never brings the dive reflex on. It doesn't give you that parasympathetic. And that's because partial cold water immersion will activate vasoconstriction in part of your body. When you go whole body up to the neck, there's nowhere for the blood to go. It signals, it tells your body, get ready to dive, and the vagal tone will improve as a result of that hormetic stress. So cold showers where a lot of people start, but I'd rather start someone who's impaired thermogenic, their thermoregulatory system is impaired, in a cold tub.
So let me ask you, in India, they have a large pail of cold water, okay? And and then they just pour the whole water on their body, including in their head. Okay, and just doing it once, there are people, those who are doing every day for most of their life, and they have remained young. So is it necessary that you need to be 2 or 3 minutes or 4 minutes in it? When one pail of water, when you put on your body, it doesn't take more than half a minute.
We don't know the minimum. It'd be great to have the minimum effective dose. So Susanna Soberg at University of Copenhagen, when she was a doctoral student, she did her dissertation on PET scanning of brown fat in winter swimmers. She asked the winter swimmers, because, you know, they do that in Denmark. They jump in the fjord or something. She said,
Right.
well, how often do you go in? And they responded to this survey. She calculated that the average was 11 minutes a week at 4 degrees Celsius. We know that 11 minutes a week, 4 degrees Celsius of whole body is sufficient to maintain brown fat because she's measured it. But what we don't know is less? Can you go warmer? Could it be 5 minutes a week or 6 minutes a week? No one's probed for that lower threshold. My sense is that your body tells you on an individual level, you know when you're cold acclimating. And I get that sense because that's been my experience. If for whatever reason, I was down in Colombia for a workshop on artificial intelligence and biotechnology and things like that, and I didn't have an ice bath. And I said, well, I'm going to go in the ocean. But I don't know if you know this, but the Caribbean Sea is not cold. So I get in there and it's like bath water. A week later, I've been away from, you know, my Morosco. When I got home to Arizona, I didn't feel cold acclimated at all. There was something that happened in that week there. I kind of lost my thermoregulatory defense mechanisms, and I didn't have to start all the way over, but I felt like a wimp when I first got in again.
I can relate to that.
And then
right.
there is another articles published that when they go for skiing, then they measured their natural killer cells before they went out to ski and after they did it, and their natural killer cells went down. So when you say that it helps the cancer to, it really on a long-term basis, it clears the cancer. If the natural killer cells are doing the main work of clearing the tumor cells and other things besides, doing the cytokines and pro-inflammatory cytokines and tumor environment. But so there must be some curve that you have to keep on doing it over a period of time so that that response doesn't occur. Because many people, they get exposed to cold and they end up with pneumonia, they end up with a lot of colds and infections. So this is the usually how the patients respond. The minute you tell them to do something, no, I cannot tolerate cold. I cannot do this or I cannot do that. So how do you overcome that?
I haven't seen the paper on the skiers. I'd like to see it. I'm fond of quoting a different study that shows with cold water immersion, the natural killer cells get a boost. And there's more than just one study. It's corroborated by other cases. But you bring up a great point. I said the number one contraindication to cold plunge therapy was hypertension. The number two is not wanting to do cold plunge therapy. Like, there can be no coercion here. There can be no bullying, because if you sort of force somebody into it, they will not get that incredible euphoric sense of accomplishment from the experience. So sometimes people say, oh, you know, I hate the cold and, you know, that's just, it's not for me. And I say, well, that's okay. But if I really care about them, I say, for you, all the reasons that you're thinking about to stay out of the cold water are exactly the reasons to get into the cold water. They are not seeking, or perhaps they're not appreciating the role that discomfort and hormetic stress can have in their life. I have talked to dozens of people who say, I hate the cold, and that's why I'm going in right now.
Yeah.
Okay, then there's another thing that there were some chambers that had, you just go in and stay there for 3 minutes and then you get out. And they were in a vogue for a while, and now I think most of them, they're out.
There's a good reason for some people to use those cryotherapy chambers. It could be liquid nitrogen, or it could be something else that gets you down into, say, 150 degrees Fahrenheit. And those reasons include they don't want to get wet. I mean, that's not everybody is ready for that, and they don't want to towel off, and it's fine. Another reason is they think the water isn't hygienic. And in some cases, they might have a good point. They don't want to get into a bath that other people have been in. And so they can get a lot of benefits from the whole body cryotherapy. But when I tried it and they said, under no circumstances be in there more than 3 minutes or something, I did 8 minutes and I walked out because it was boring. There's something about the cold air that does not extract heat from the body the same way that the cold water does. And it has to do with the thermodynamic properties of the water. The air can form a warm annulus around the skin. It doesn't suck the heat out the same way. And so when you're already cold acclimated, the cryo chambers, if you're like me, they're just not going to do it for you. However, if you're one of those people that doesn't want to get wet, or you're worried about the hygiene, or you're just starting out, I think whole body cryotherapy is a great way to go.
It's also very expensive. That's why I didn't go with
Yeah,
that.
yeah, that was one of the reasons that they charge quite a lot, and because the
Agreed.
cost of the chamber must be high, so.
Yep.
So
Oh,
how
yeah.
do you maintain? How do you lower the temperature of the water in the tub that you showed in the picture?
Oh yeah,
Refrigeration.
Yep, refrigeration.
I'm sorry, what?
It has a compressor that moves a working fluid, a refrigerant. We use the same refrigerant that's in automobile refrigeration. And it has evaporative coils underneath the tub. And so the ice forms on the bottom. And then the compressor will move that, compress the refrigerant into the hot coils that are out on the side. So it's a 100-year-old technology. The key is getting the evaporative coils in thermal contact with the water. And because it's kind of difficult, we're the only company that does it in North America.
The patient sits on the ice?
No, where
Correct.
they sit, there's no ice generated where they sit. Where my mom's sitting there, it only generates around her, you see. Yeah.
Stefan, we call that the no butt burn zone.
No butt
When we
burn.
first met them, people sat right on the ice, but there was a bikini model, and her bikini froze into the ice because she was in there so long, and it pulled away some of the skin off her butt. And this is like a disaster, before a competition, and we had to rearrange the way we did it and create this no butt burn zone.
Yeah. No, there's
So
no
there's
butt.
a special seat there that they sit on? Or what?
No, it doesn't create ice where they sit back there.
So how do you drain it then?
Well, we have to do that every week. We change the water every week.
No, but after each patient I'm talking about.
No, we don't drain it. It just stays cold 24/7, but we change the water and it filters the water constantly with an ozonation system.
So it is a real cold water at 36-degree temperature or what?
Yeah, 36 is the average. Sometimes colder if we put some ice cubes in there.
Okay.
Can I do a quick interlude just because it seems to be time?
Sure.
Our team with all these wonderful people are putting together, including Dr. Quinn and a whole bunch of you other good guys, are putting a research team together. And some of the subjects you were just talking about, hot, cold, yes, no, what, we can do research in some of this areas and present information or collect information just like Stefan's doing now, right? So anyway, we're putting together a research team with this integrative group, and we got a whole bunch of smart people. I'm not a research guy, but I'm kind of collecting the team now. So I put in the chat my email and the reference to the research. If you have any interest in joining this crew and putting some research ideas together, we're totally interested and willing to work with anybody. So we're just trying to put the team together now. What we do, I don't know. We already started doing work out of the United States. That's how this stuff started, because research was denied in the US. So that kind of makes it rough. So anyway, but now who knows what we can do. But the kind of questions you're asking tonight, I'm in the same thing. We all have our opinions and we all want to know the truth, and our research programs can do that. So get in touch with me, please, if you want to have anything to do with research. Thank
Yeah, I
you.
get-
I just emailed you, John. We're
Emailed
having
you
a
too.
research planning workshop here in another 10 days. I got physicians, scientists, patients, people who are using and are curious about cold plunge therapy coming to meet with me on campus at ASU, where I'm a faculty member, and we want to outline both the research translation and see if we can guide the new clinical studies that this industry needs.
Wonderful. So anything that's already happened, we want to promote. Anything that needs to be created, we'll create.
Excellent.
Dr. Seeger, I was a medical director of a gym in the past, and we have one of these cryotherapy chambers. So one of the things that we actually want to make sure we check is actually any devices on them before they get in there, especially now with the rise of like Apple Watches or anything that's electronic. I don't know if your machine is different and it can actually not destroy these devices when they're in there.
No, it's fine. You know, I wore a Dexcom, and the Dexcom, it seemed to I don't know what happened. I asked Dexcom, but what happened is my blood sugar would drop very low in the Morozco. I don't know if you ever heard someone tell you this, Thomas, but yeah, it would drop. My blood sugar would drop to like below 50, and
Oh,
I didn't
wow.
feel, I
Yeah.
didn't feel bad. I mean, but that was the only
Here's what I
electronic
think is
device.
going on. Where did you have your Dexcom inserted?
I wore it once on my belly and I wore it once on my tricep to see if it would make a difference, but it didn't.
Well, then that blows my hypothesis out of the water, because I was thinking maybe vasoconstriction on the limb and then the
Yeah.
skin, because the Dexcom doesn't penetrate very low. And you would get like sort of this temporary drop in blood glucose in the periphery. But if you had it on your belly and you observed and you're getting down below 50,
Yeah.
I'm actually amazed that you didn't experience extreme brain fog and disorientation.
I asked Dexcom and they never have tested that out of the extreme temperatures. Who knows what happened there? But you can wear things in the cold forge if it's waterproof, it's fine.
Could the temperature have an impact on the reading of the technology?
That's
I
my
mean,
theory.
some technology is real
It doesn't
sensitive.
it doesn't test your blood sugar. It tests your interstitial fluid. So
Yes.
that's why.
Oh, what about your like people with pacemakers or any of these things? Is that a contraindication?
Never had a pacemaker, but we have a guy with titanium hips and he goes in there for the
Oh, those are
arthritis.
okay.
Yeah.
Yeah. I was just worried about could you alter the function of that pacemaker in these extreme temperatures? So
Possibility.
yeah, and also do we need to get vital signs before these patients
Yes.
get in there? So
Oh, yes. I test their blood pressure before and after the cold forge. And if they get very hypertensive afterwards, I talk to them about that and we treat their high blood pressure because sometimes the cold forge can reveal some pretty significant hypertension.
mhm. Well, so basically you're saying it should be ran in a medical facility. So like medical
Yes.
spas ran by non-medical providers should
No,
not be doing this. Is that correct?
no. My goal was always to include this in the medical facility. What other people do, I don't know, but it's perfect for a pain management or primary care facility.
Mhm.
Yeah,
Yeah,
that's fast.
even when Dr. Seeger mentioned about like cold showers, right? And then jumping into like turning it into warm or hot. you were saying that's not even close to the benefits of what this device can do, or
Yeah.
and you're even saying it's counterproductive doing those. Is that correct? Because of just putting you into vasoconstriction mode, Dr. Seeger?
I don't know about the counterproductive, and if you could ask me again, it might come to me.
Well,
Oh,
what I found,
yeah. Go ahead, Stefan.
well, I found that people they'll go to like a cold plunge, or they'll put ice in their bath and might get to like 50, but they don't get the pain management benefits when it compared to 36 or 34 degrees. It's completely different.
Right. Well, again, brown fat, I always hear that in my pediatric rotation, that it's the one that thermoregulates the babies. But now as you see that not only babies have the brown fat, we have these brown fat, we can reactivate them. And like we're like babies again. But from the looks of it, this is really amazing. Now with the advent of GLP-1s in relation to weight loss. So this definitely is a good combination therapy with that at hand.
I'm glad you mentioned weight loss, because for a long time, people have been trying to use cold therapy to boost metabolism and cause sort of a passive weight loss. I've never seen it work. You can hook up a continuous ketone monitor, and you can estimate the amount of fat that is being burned while someone's in the cold and recovering from it. You can say, look at this tremendous metabolic boost. And so that's true. But there are no before after pictures on Instagram of, someone who kind of looks like me, and then they started doing ice baths and they got totally ripped, because it just doesn't work that way. The studies I've seen in rats demonstrate that there is a compensatory metabolic sort of depression that happens at night. Core body temperature drops and the body rebuilds the fat that it consumed. This is the classic sort of homeostatic response or homeostasis of the body. Although for hours your calorie consumption will go up and your fat burning will go up, the ice bath is no panacea for weight loss. I agree with Stefan when he said the 5 or 6 pounds that he noticed come off right away. I think it's mostly inflammation. And then you had the bodybuilder lost a lot of weight. But I don't, because he's a bodybuilder, I think he's an extreme case that I wouldn't apply to someone like me. And I don't want to generalize from that.
Well, I'm thinking it's really more of an integrative approach rather than solely basing your weight loss result from the cold plunges. Combining it with the other modalities, definitely, I would definitely go for that as I can see it. But by itself, me saying that this will do the trick for you, yeah, probably not.
I can agree to that.
But good stuff though. It's just that I need a space here in our clinic where to place that. That's a big tub that you need to
Yeah,
have for like in a
space
room.
do you need, Dr. Seeger? How much space do you need for?
Well, we had a physician in Toronto call me up and say, I want one of your ice baths, but it's too damn big. Can you make it more compact? And then I'll get in it and I'll be more upright. And so we came out with a new product for him where he sits in it instead of lies down. And psychologically, people feel a little less vulnerable when they're sitting compared to, being on their back. He installed it in his bathroom at home between his toilet and his sink. And this is why he only had so much space. We put a couple of pictures of that up on Instagram, and we've sold 28 of them since. So how much space do you really need? Not as much as Stefan is using, about half. That is 32 inches wide, so it'll fit through like kind of a normal door. And then this more compact one that we have is like 37 inches long.
Bigger question, how much is it?
It's expensive.
Expensive, but it's worth it.
Right. The at-home model, I think, is $14,000. And then the one that Stefan has, we just raised the price on it to like 22 or something like this. And then the one that we did for the Toronto MD, it is even more expensive than that to get the commercial model. So
Yeah,
it
mine's the
sounds like a
commercial.
lot of money, you can get a cheaper cold plunge for, you know, like $4,000. And so sometimes people on Reddit will give us a bunch of crap. Why is it so expensive? The answer is because we have the best warranty, we have the best customer service, and we're the only one that makes ice.
It
When
works.
you
I mean, I've been
read-
running this 24/7 for a year and it's still working. And I'm run a facility with 80 members and people can use it 24/7. The only thing that I would recommend, and the Secret's helping with this, is making it more higher capacity. So we need a better sump pump. We need to be able to suck water in and out of this and clean it a little bit more robustly because it's not scalable beyond like 100 members.
Yep. So the one that we have on our bench now, Stefan, it has 3 times the filter capacity, 3 times the flow. It's got the dual ports with more ozone, and that hopefully will mean you don't have to swap the water out every week. You can just you can dip a reading. We did a bacterial count to ensure that our oxidation reduction potential is correlating to low bacterial counts. I'd love for you to just be able to top the water off rather than have to swap it out so often.
Yeah.
And so the point I was making about why is it so expensive, we're upgrading Stefan's unit and we're doing it at our cost because we've got all this great data from him. We've got this great feedback. It's learning what to do with all the materials. It's learning how to make it work. The knowledge is embodied in the product and the warranty is for 5 years. It's no questions asked compared to the other companies that won't warranty for commercial use. We're kind of out on a limb. And so, yeah, we cost a lot more.
Stefan, if you don't mind me asking, how much do you charge for sessions?
I don't charge per sessions as part of the membership to the facility.
It's like a package, basically.
Yeah, it's just yeah, I think it's only $70 a month and it's like a gym membership. Like a nice
Oh,
gym,
nice.
nice private gym.
There's a question.
If I could go back about 100 years, I was wondering, because you haven't mentioned heat at all. But 100 years ago, chiropractic, whatever, from 100 years to the last 50 was doing heat as the way of treating the same things you say you're treating with
Well,
cold.
I got a whole lecture on heat next. I
Well,
got
that's-
you, Dr. Burgess. You just
Okay.
wait.
Well, that's why we got the research. I want to show both sides of this, and I want to know what the truth is. I was also
get
going to ask the question, if we alternate between cold and hot, has anybody done a study of that?
I ban it from my facility because it makes my water filthy.
That's true. And we're working on that, Stefan, because it does look like there's some benefits by doing thermal contrast therapy. People report that it's delightful, and they do have similar cardiovascular benefits, circulatory benefits. And so it's kind of a natural. What if I go back and forth? The cold is vasoconstriction. And as long as you're doing dry heat, not the hot tub, but a dry sauna, you get vasodilation. And the whole thing, it makes a lot of sense. What we suspect is that you should do cold and then exercise and then sauna for recovery.
Yes.
And almost no one let me rephrase that. No one has investigated that kind of triple stack in a clinical setting. They've done cold and exercise. They've done exercise and sauna. They've done cold and sauna, but they've never done this sort of 3-stack sequence. And so it's on my research roadmap.
Oh yeah, that's what my protocol is. I train each member of the facility to do that. They do a cold plunge. I bring them out. I teach them how to work out, and I teach them how to do the sauna in that order specifically. And there's a lot of mechanisms and reasons for that. And we see, I think part of the research why mine is so positive is because not everyone's doing the workout, but everyone's at least doing the cold and the sauna.
There's a question
Excellent.
about what is the temperature needed to turn needed for brown fat production or reactivation?
I'm not sure. Dr. Seeger, do you know this? Because all the research I did was on the nitrogen ones that showed brown fat.
Most of the research is on cold air. This study in Germany took these middle-aged men. I'm calling them middle-aged because they were a little bit older than me. And they were obese and they met the diagnostic criteria for type 2 diabetes. And they had them for a week, and they gradually went a little colder and a little longer. And in this study, they weren't allowed to exercise and they couldn't change their diet. They eventually got up to 4 straight hours, and I'm trying to remember what the temperature was, but it was like upper 50s, almost 60 degrees Fahrenheit when you do the conversion from Celsius. It's not even that cold. And they got, among some of their subjects, an 80% improvement in measured insulin sensitivity. That is amazing for a week of just sitting around watching television with your buddies. They asked these subjects, did you shiver? And most of them said no. Did you feel uncomfortable? And they were like, well, you know, only sometimes. And so I wonder if that was cold enough to activate and recruit new brown fat. I think the upper limit is probably, for cold air, in the upper 50s. You get the insulin sensitivity benefit, but I doubt they didn't do any PET scanning. I doubt that they recruited substantial brown fat. The studies that I've seen that report a shiver response that did measure brown fat, they're more reliable. So how warm can you go? Probably the upper limit is something in the 50s. How cold do you have to go? If you feel the shiver, then brown fat is activated by the nervous system. It's highly innervated. It's not directly connected to thermal receptors in your skin. The thermal receptors have to signal the hypothalamus, and then the hypothalamus signals the brown fat. If you feel the shiver, you know you've been cold enough. So you could test your own body if you're inclined to experiment.
Great. Okay. Okay. So Stefan, we'll have you back for the next time we have a dropout.
Oh, sure.
For the heat.
Could I ask a question,
Yes, please.
Sure.
Melvin? This is kind of a delicate question that needs to be tasteful. It's affects, cosmetic and anti-aging, and it affects both men and women. So I was curious if there's a brown fat effect on cellulite, flaccid skin, wrinkles. In older men, they lose gluteal robustness, and there may be a need to rehab these gluteal muscles to regenerate them. Also the effect on scalp and hair health, and also neuropathy, so I want to ask if this therapeutic regimen can affect these things in a positive manner.
You have a lot in this question that I'm going to
course.
classify as cosmetic or aesthetic.
Right.
But it's not just so. A regular practice of ice baths will remodel the body composition. It will reduce liver fat and visceral fat, which is very dangerous, and it will increase subcutaneous fat. And sometimes that will help sort of smooth out some of the wrinkles. It's certainly good for health, but I don't have any systematic information on cellulite, on that kind of youthful appearance that women are going for. I have one case study, and gosh, I'm just going to tell stories on AJ all night. She had her breast implants removed, and she was 39 or something. And of course, like a lot of women who explant, the grief is really difficult to deal with. She feels like she's never going to look good again. She has to get reconstructive surgery. And so she was taking photos to try and document this. She wrote these articles about it. But because we've been dating for so long, it's a delicate topic. And I finally said, babe, your boobs never look better as when you're in the ice bath. Everything tightens up, It's like you're getting a lift just from the cold. And this is my subjective observation. And she says she doesn't buy it. So we haven't done that study, but I'm tempted to try it.
How about neuropathy?
What type of neuropathy are we talking about here? What would be the origin of this? Because I'm about to link you to an article.
A diabetic?
Absolutely. There's another story here. So AJ, she shrunk her tumor, and she's feeling good about herself metabolically, and she was watching her cats. And her cats weren't doing so good. They used to be outdoor cats. Now they're indoor cats, and they were getting fat. And the older one in particular couldn't even jump anymore. And it dawned on her, cats are obligate carnivores, and she'd been feeding them dry food. Now, she's not going to put the cat in the ice bath, but she switched them to all canned food. She wanted them on a carnivore diet, and their neuropathy resolved like that. And so for her, it was like, ketosis is working for me. Cats are obligate carnivores. And that's a fun story. But I have a friend who's a customer, diagnosed type 2 diabetes. And so he wants to do everything right. He goes to his doctor, he's taking metformin, he's doing the ice baths, he's exercising, he's on his bicycle, he's doing the sauna, and he says, I cannot get my blood sugars down below 140. I feel like I'm eating a clean diet and I'm doing everything they tell me to do. I said, have you thought about quitting the metformin? He goes, no, my doctor wants to up my dose. I said, if it's not working for you, don't do it. Well, I just had a conversation with Ben Bickman. He's at Brigham Young University, and he had just come across this paper where metformin undoes the mitochondrial benefits of exercise. Those are his words. That is, it counteracts the mitochondrial benefits of the exercise. So I went and read the paper, and damned if he didn't put it exactly right. If you can exercise, you will get mitochondrial benefits. But if you exercise and take metformin, you will make no progress at all. So I asked my buddy, stop taking the metformin. He said, all right, I will. 6 weeks later, he video calls me up. He's wearing a continuous glucose monitor. He's eating lunch. And he says, Tom, I want to show you something. What's that? He holds his phone, with the 94. He goes, this is a postprandial blood sugar reading. I have never, since I've got a continuous glucose monitor, seen a 94. He doesn't even meet the diagnostic criteria for diabetes anymore. And this allows everything in his body, all the damage that is being done by the elevated insulin and the elevated blood sugar, now it can heal. So I'm giving you these two stories, but I've written some articles that summarize the literature on this, and you can find the clinical citations on these articles that we put in our website.
Dr. Singer, quick question. How old was that guy?
He's a little older than me. He's 62, I'm 58.
Okay, I've been hearing and reading and seeing information saying that the exercise thing and the metformin, that people that are older should not be doing the metformin.
They should not.
Yeah.
I feel very strongly about this.
Results just like you're talking about.
Yep.
It's metformin is really great. I think if you're in your 20s and 30s, now I'm just shooting from the hip here, but I keep hearing this.
Well, I'm going to tell you my hypothesis why. Metformin will lower your blood sugar. We know this, but it does it at the expense of your mitochondria, not by supporting your mitochondria. And so when I ran this past Ben, he says, well, look, it makes sense as a hypothesis. The question is, which comes first, the insulin resistance or the mitochondrial damage? And I said, the hypothesis here, Ben, is that the mitochondria suffer first, and that insulin resistance is the body's attempt to protect the mitochondria from further damage. So when you take Viagra or metformin or something that overcomes insulin resistance, you do it in a way that furthers the mitochondrial damage rather than gives the mitochondria a chance to recover. Now, if you're young, your mitochondria are still doing great. You still have a little bit of bound fat. They can sort of take the hit and it overcomes the insulin resistance, lowers the blood sugar. But when you're old, and I hate saying this because it sounds terrible, but your mitochondria are hanging on for dear life. And I mean that literally. When they go, you go. And so therapies that stimulate mitobiogenesis, that support mitochondrial function, and especially induce mitophagy along with mitobiogenesis, those are the real therapies, and they make metformin superfluous.
I have one I maybe have skipped here. It was a patient with trigeminal neuralgia pain. Let me see if I can flip back to this one here. Yeah, so she's 63 years old. She had the trigeminal neuralgia pain, and her pain was a 6 out of 7 before, but when she goes to the cold plunge, she can bring it down to a 2. This is the first I've ever heard of this specific sort of neuropathy pain being treated with cold forge therapy. Her mood would also improve from a 5 to a 10, and she would have energy benefits for 60 minutes. she would only need to stand there for 20 to 30 seconds to see this benefit. And she's really not even going that much, like once a week. So I haven't had too many other people with neuropathic and neuropathy type pains, rather than, differentiate that from radiculopathy pains. Radiculopathy pains, we can treat that more readily, but maybe it's just not the type of patients that I come to see me. But there may be another reason why the diabetic patient may improve with this. This is a patient I've been working with for the couple of months here. You can see his previous insulin values were 15.5 and 14.7, but then they went to 5.7. And the main difference between these numbers was that he actually started joining the gym out back, the Human Performance Arena, and he would do cold plunge. He didn't really work out. He's not like a huge workout type of guy. He does have that kind of flat buttock appearance. He would do sauna. He'd do sauna as well. And he would do bike. So we have a specific thing called the exercise with oxygen therapy. It's this high oxygen, you breathe high oxygen, you get on the bike. That's the only sort of exercise he did. And then he did change the diet as well. So I think just by practice of embracing cold forge practices, you can reverse a lot of the diabetic or metabolic problems because you're changing your whole lifestyle as well. You're doing a whole bunch of things along with this, right? Most people who do cold plunge, they're also adopting radical life change as well. So there's always that variable.
So Dr. Horowitz was put in the chat what I was thinking, that we always recommend coenzyme Q10 and B12 with metformin. Does that seem to be part of the issue that you're talking about, especially with more mature folks? And define older, by the way. So,
Older is anybody older than Stefan?
well,
It's all this anti-aging medicine. I could be as old as you guys.
that. So trans resveratrol has, if you use a high enough dose, will convert white fat to brown, or rather brown fat to white fat to brown fat. Have you had any experience with that, or that as an add-on? So eat about 100 milligrams a day for at least 4 weeks.
Isn't that a poison a bit? Didn't get disproven? Didn't Sinclair kind of fudge those?
There's two types of resveratrol. There's a cis.
Oh, okay. I'm thinking
the trans is the potent one. So,
and then also it has a lot to do with bioavailability of the resveratrol. Theoretically, Sinclair takes his with yogurt. That's supposed to be the big thing.
okay. What about peripheral? You may have already mentioned this, peripheral arterial disease.
Yeah, so
counterintuitive that the cold therapy would seem to be a relative contraindication there, right? Yes, no?
yeah, arterial disease. They may often have high blood pressure along with that, and so we need to go careful with that.
I don't know.
So,
Hey, I'm going to ask, since you brought the subject up, you remember Our Lady who did the nitric oxide,
yes.
and which is approved medical solutions, I believe.
Mhm.
Anyway, what was shocking about her study to me is that you may have remembered they checked for cholesterol plaque in her peripheral arteries, and there were none. Was I hallucinating, or did that really happen? And has it been studied in anybody else? Because that means the whole world of medicine changes if you can totally remove cholesterol plaque just by using nitrogen or nitric oxide in her form. So anyway, I wonder if anybody's heard anything more about that. It's important.
It's a possibility. I'm working on a few case studies to try to reverse calcium plaque and carotid artery disease. I have one positive case that I'm compiling, and I can give you guys a lecture on that at some point. And we are using nitric oxide extensively at the practice too. We're using the Berkeley Life product.
Yeah,
John, I've seen that before, but not only are you using nitric oxide, but it was combined with the glycocalyx product. And I think that was actually backed up by actual studies. And yeah, it's actually Arteriosil that actually did that, and Vasconox in a study done by Dr. I forgot her name. She's a family med doc who showed these through her carotid scans that she done while taking these two products, not by just the Vasco, just not the nitric oxide alone.
Thank you.
Great. Anything else?
What were the two products? Can you say that now, or?
I'll put it in the chat here if you want.
Yeah, it's Arteriosil and Vasconox by Calroy. Since
Got it.
the audience asked for it.
There's a question about, can you give us a little bit more about oxygen during exercise?
Yeah, I can maybe do a whole lecture on that, but that's an old German therapy. They've been doing that for a while. I think popularized recently here, but athletes have been using it for a time. That basically you get on this oxygen compressor that you use for a hyperbaric machine, but you put it up to this non-rebreather mask and you get on a bicycle and you bike and breathe 96% pure oxygen through the nose and out through the mouth. That's also supposed to improve nitric oxide and can help patients with poor nitric oxide producing diseases like diabetes, cognitive dysfunction, long COVID, spike injury, and so forth.
Okay. There are a lot of links in the chat. I'm going to see when we post the video. I'm going to see if I can put them in the comments, so you don't have to sort of scramble for it. Okay. The videos are on aosrd.org. And also Clearfield Medical Group on YouTube. So,
Okay, do we get the CMEs tonight?
I have to talk to Dr. Halassa since this was a last minute. I'll try and get it get it together. So, Stefan, I think you sent me the objectives.
Yes.
Sent them just this afternoon. So I'll try and get it together, and I'll put that on the I'll put that on in the on the link to the video. Every week now, when you get your email for what's coming up, I've been putting on the video for the last couple of weeks and the link to get the CME credit, so you can do it that way. So I'll add that one on. This one I didn't have because of our issues here. So for those of you who don't know, you can get 2 CME credits for $30. Through it's called EEDS. It's Dr. Jackson out of Michigan. It's their group, and there's if you look at the email that you received at the bottom there about the last 5 or 6 sessions. There's the video, and then there's a link for the CME. It's just a click a couple of links. It's $30, and you get the certificate. You can print your certificate out right away. It's 2 AMA Category 1 CME credits. So I'm going to have to do a little cut and paste here because there was a couple of brand names mentioned. So we'll have to take those out, but we'll take care of it.
I'm glad you're working with Dr. Jackson's group. That's cool.
Yeah. So, well, I'm doing it through Halassa, but
Halassa.
as you know, sometimes that can be a challenge. So,
well, I'm glad that we corralled. I've been trying to connect to all these functional medicine cats together, trying to get everybody to talk together. So maybe I'm successful here.
Well, you're doing okay. So we're in with Dr. Farshian's group on Wednesday night. Claudia and I are good buddies now.
Good.
And and we've had, and I want to acknowledge, by the way, Dr. Nario has invited quite a number of physicians from the Philippines, and they've been on with us tonight. And we really are happy to have you with us. We're here every week at the same time. It's 5 p.m. LA time, 8 p.m. Eastern time, and I believe it's 8 a.m. in the Philippines. Is that correct?
Yes, that's correct. So this is actually the group of they're called PRIMA. So PRIMA is preventive, regenerative, and integrative medical advancement. So they're integrative Philippine doctors who are definitely great advocates for what we preach. So I'm happy that they're here, and hopefully we can help them out as well, and vice versa. We want to learn from you guys as well, and hopefully share your knowledge to us. And for sure, we will be learning a lot from you guys.
Yeah, we're gonna twist their arm to give us share some of their knowledge with us also. So,
Oh,
so we're
yeah.
happy to have
That'd
you
be
here.
great.
Like I said, there's a number of names, and we always ask for you to bring one friend a week, and then we'll double our census. We had a pretty nice crowd tonight. And thank everybody for hanging in there with us. It was very interesting. Dr. Seeger, thank you so much. It was really very informative. What I usually say when we have a really good session, is that's the price of being competent is we're going to ask you to come back. If you don't hear from us again, then and I always use the analogy. Nobody ever asked me to help them paint their house a second time. I never get asked the second time. So well,
it was a pleasure to step in.
Okay, well, thank you so much, especially at the
welcome.
last minute. What is this? It's like a pie lecturing contest. I don't know what that means exactly. So,
I don't know what that means either.
okay, so it looks like also a study in aging cell on metformin age 62 to 63. So is that considered old now? Over 62, 63? Is that considered old now? Is that? I'm just trying to figure out where I am in the hierarchy here. So
Yeah, absolutely not.
so
Really not.
okay, yeah, 80
Just,
doesn't
just take a
sound so
little
old.
bit of your, just take a little bit of your own anti-aging medicine.
I'm
Dr. Bill.
doing it. I actually after last week I ordered a rapamycin, so I'm still waiting for
Me
it.
too.
Yeah. So and then when I go home, I'm gonna go into a cold bath. So
Good.
I gotta stop and buy a thermometer though to make sure I get the temperature down low enough. So
All right.
and we got from the Prima folks. Thank you, Dr. Nario, for inviting us. And yes, thank you so much. And yeah, Dr. Stoker says 63 is the new 36. So we like that too. Okay, Dr. Seeger, before we leave, we always like you to. Can you give us a short summary? Give us the. I learned a new lingo. TLDR.
One didn't read.
I had to look that up. I kept seeing that. I said, "What is that?" So too long, don't read. So can you give us three big points?
Gosh, short is not my specialty. Here we go. Human beings are evolved to expect cold exposure. Our ancestors didn't survive the ice age population bottlenecks without becoming cold acclimated. When we don't get cold, we lose our brown fat, which tends us towards metabolic dysfunction. And there are a number of diseases ordinarily associated with aging that stem from mitochondrial damage, not from the number of years that you've been on this planet. When you get a little bit of cold, you can stave off the aging by improving the quality of your mitochondria, and the systemic benefits for inflammation, for pain, for mood, for brain function are, for lack of a scientific explanation, miraculous.
Okay, thank you. So didn't our nomadic predecessors leave the north and migrate south during the winter months here, especially North America? That seem to hear stories about that.
I think it was all over by then. That is, the mitochondrial DNA are, I mean, for the most part, with some exceptions, inherited exclusively from your mother. And because there's no sexual reproduction in mitochondrial DNA, they evolve much more slowly than the DNA in your nucleus. Now, you go back, let's say, 70,000 years to one of these population bottlenecks that was associated with a permanent winter, a volcanic eruption that meant there was really no summer. The mitochondria that we have, they aren't adapted to wherever our ancestors moved, say out of Africa. They're not adapted to the North American nomadic lifestyle. They're not adapted to Southeast Asia, because that bottleneck is so recent and the rate of mitochondrial evolution so slow that we are in this mitochondrial way, virtually identical to those Homo sapiens that came through those deadly ice ages.
I don't know. My mother's mitochondria spent winters in Miami Beach, so I don't know.
So did my Nana, and she lived to be 98 years old.
Yeah. I don't know about that, but okay, we'll take it. So, okay, Stefan, the last word.
Always cold and then workout, not the reverse way around, right? We use cold therapy to enhance building muscle as a pre-workout, as to stimulate us to hit the weights hard. The only time to use cold plunge after training would be if you did high intensity endurance exercise, maybe like marathon running. We know this suppresses the immune system, and you can actually use cold therapy to bring back the immune system from these long endurance. From heavy pounding on the joints, again, any sort of arthritic condition, the cold therapy is well known to help recovery, so it can bring the athlete back to playing quicker, so it can be used in that modality. But I always have to tell my members at the practice not to use any anti-inflammatory after muscle building activities. And this includes ibuprofen. This includes things like turmeric, and that includes the cold forge therapy. We never really want to cool off the inflammatory effect that we try to achieve when we're like lifting weights to grow muscle, type 2 muscle fibers.
Okay, thank you. I almost forgot. Dr. Zarin, the homeopathic guru in Toronto, is holding a online homeopathic alternative medicine seminar July 12th and 13th, and she needs a couple of speakers. So if anybody's interested in speaking on homeopathy or anything, any alternative therapies, please contact me, and I'll let you, we'll get you in touch with her. She needs about 4 or 5 speakers still. So, she usually runs a pretty nice show. So, if you're interested in that, and if you're new at it, you're not sort of, well versed in front of a crowd, this is a good way to go. Basically, you're talking to a machine. So it's a nice way to get started. So if you're interested, anybody's interested in that, please let me know. It's July 12th and 13th, but I need to let her know, as soon as possible. Okay. So I almost forgot about that. So, and we lost, some participants in the interim. So, okay. So thank you so much, everybody. We really are, quite grateful for Dr. Seeger, and of course, Stefan, you're always you're always there for us. Dr. Burgess, how are we doing with the medical school?
Everything's beautiful. If you want to do research, get in touch with me, please, because we're trying to tie it in with the medical school. Thank you.
Okay. That's University of what's that? West Virginia's Osteopathic School of Medicine. That's the school?
I don't know.
Cool some other name probably, but
Cool Dude Medical School.
Cool Dude Medical School. Okay.
That's it.
Dr. Nario, thank you for your your sort of report. There is Stefan and I did a video. It was a year and a half ago on an AMMG
summary
that we did it in a car going to dinner one night, and it was pretty fun. It was pretty neat. We just sat and we just talked about what we had seen and all. And there is a video on our website if you want to look at that. Just type in your Open Apple or your Control F and go type in AMMG, and it'll find it for you.
Yeah, it's on my YouTube channel too. Iron Direct Primary Care. It's a classic.
Yeah. So yeah, it was pretty fun. So we really like these recaps. Anybody who's going to any of these conferences, if you want to do a 10-minute like Dr. Nario's done for us for the last 2, we're happy to have you on. We like to know what's going on out there in the world. There's too many conferences for us, for any one of us to go to all of them. Any little tips and tricks, for anything, you never know when you might need them. So again, next week we have the incomparable Jay Campbell is coming back, and Jay is going to be
Oh.
talking about his program, his GLP-1 program that he's put together. So, and he came to me and reached out to me to be with it. So, and as you know, he's always quite entertaining. He's not a physician, so he's not constrained by medical doctor stuff. He has no medical license, and he seems to have more patients and customers than any of us put together. So, I'm not sure exactly how he does it, but he can say some things that are a little bit kind of outrageous. Like there's no medical studies on hormone pellets, which of course isn't true, but things like that. So so he'll be here next week, and he'll be talking about GLP-1s and his take on the how to handle them. So that'll be next week.
I'd like to join you for that if that's okay.
You may. We have your.
All right.
I'll get your email address from Stefan. We'll put you on our list. Okay.
Yeah,
and-
thanks very much.
And yeah, anybody, anybody and everybody. It's we're happy to have you here. I'm not sure what Stephen means. I would included Banerjee and Narayani systems.
These are homeopathic methods of administration. So these are protocols.
Okay, well, okay, Stefan. Well, Stephen, get in touch if you want to let me know, and I'll get you in touch with Dr. Zarin, and we'll get you all together, get it all together. So, CBD and cannabinoid, I'm gonna, we can bring it up to her, and we'll see what flies. So, okay. Okay, any questions, comments? Thank you, Stefan. Thank you, Dr. Seeger, thank you, Dr. Quinn, Dr. Burgess. Thank you to the Prima people for being here. Please come next week. And anybody from Prima, you can use Dr. Nario as the go-between. If you have topics you want to bring up, if you want to present, we don't bite, only on Thursday. So usually Tuesday night we don't bite. And we're happy to have you. We need at least 61 minutes of a didactic, though, so that for the CME credits. So, so that's pretty much the only requirement, and we try to stay away from brand names and brand brand stuff. So, okay, so let's see, and okay, and thank you all. And Dr. Seeger, can we get an email or a phone number or something, how to get in touch with you? I think you put it in there, but
tpseeger@moralescoforge.com. I can put it in the chat.
put it in the chat. Yeah.
Yep.
Yeah, Dr. Seeger's got a book, and he's also got a conference coming out.
True.
All right, hold on.
Yep.
Hold on. Okay, thank you all very much.